Okay, welcome back. I hope you've all managed to get coffee, something to boost your glucose levels in some way, and have a chance to look at the posters and also catch up with a few people. So here we are again for our next session before lunch. So what I'm going to do now is just introduce our research programs, which I hope are familiar to most, and a little piece of work that we've been doing on these programs. So I'll just cover the programs first. And we've talked about having four, I said on my number, so SPHR by numbers, we have 4 research programs, and they are up here. This morning we're going to hear very shortly from Children, Young People and Families, and then after lunch from our Public Mental Health programme, and then tomorrow, it might feel like next week by then, but tomorrow we'll hear from the Healthy Places, Healthy Planet and our Health Inequalities programmes. And so just because on here you'll see that you might think, what are those colour codes? Well, it'll all become clear in a moment. But one of the things in terms of thinking about our programs is it helps us to organise our work. It helps us to think about getting people with particular interests in particular themes and within programs. But it is really just a way of organising our work. And many of the work that we do in these programs cut across, and so they should. So we have been looking at this, and it was a particular challenge from our advisory board about how we think about cross-linkages across our programs. So that was a piece of work that we have set out to do, and each of our research programs has a dedicated postdoctoral researcher involved in the programs that support those programs part-time, and they're also involved in research. So we asked that group of people to come together and help us to think about both the cross-linkage, but the other challenge that we were given was what are the other linkages in terms of methodologies, but also economics and economic analysis within the project. So thinking about those particular challenges. So I'm going to ask Kiya Hurley, who's going to speak on behalf of that group, just to give you a flavour to the kind of the work that they've been doing and what we found out so far. So thank you, Kiya.
Thank you, everyone. Wow, there's a lot of you when you stand up here. So the work we've been doing, the challenge we had was actually visualizing how these cross-linkages came together. So we've come up with the diagram you can see on the screens here with Amy in comms, who helped to simplify the ideas we initially came up with. And as you can see, there are the 4 research projects listed across, programs listed across the top. Each column then represents the projects within that program. So the coloured bars underneath then correspond to the programs that are linked with that project. So to give the first example there, the cross-cutting data project in the Children, Young People and Families programme is linked across all of our research programmes because it's in Children, Young People and Families, and you can see the 3 bars underneath it. So then to get a flavour of how many cross-linkages we have, we've got 3 projects across the programmes which are linked in all of our research programs. So that's the cross-cutting data project that I've already mentioned, the active and sustainable travel for rural communities in Healthy Places, Healthy Planet, and then in public mental health, the improving systems for at-risk young people to engage with community assets. We then have around 7 projects that are linked to 2 other programs, and 13 which are linked to just 1 other program. We've got 2 projects which are yet to be signed off by advisory board, but they also are projects that do not have are only linked within the program that they are in at the moment. So some of the things to note, as you can see, there's quite a lot of red bars. So a lot of our projects that are outside of the Healthy Inequalities program also linked to health inequalities. And one of the things we've thought about as to why that might be is because it's reflective of the school's vision to impact health inequalities. Another thing to note is that around 50% of the projects outside of the Children, Young People and Families programme actually are looking at issues for children, young people and families. And again, we thought about that And actually, the 3 other program themes, so inequalities, the environment, and mental health, are often themes that come out in our own public engagement work with young people, and so that's why we think we might have quite a lot of linkages there. But one of the things to think about when we looked at where the sort of sub-links are, so within each program there are work strands or work streams, so we tried to see where it links there. Outside of the children, young people and families programs, there aren't any projects that are linking to our early years work stream. So that's something that we noticed there. And similarly, in the Healthy Places, Healthy Planet program, projects that link to that program tend not to link to the Healthy Planet theme within their research program. So the other piece of work we've been doing, this is something that's ongoing, so we're still working on this, but we're looking at the methodological cross-links across the program. And just to give an example here, for participatory photography, we've got 6 projects across the school that are using photo elicitation or participatory photography. And so what we might be able to do in the future is to do a whole school seminar or some workshops to share the learning across the different research programs. And that leads me on nicely as to how we are acting on these. So that's one of the ways we could do it. We're also doing things like trying to include different programs in our annual meetings and seminars that are program related to make sure we're sharing the learning across the different programs. For the programs that have their own newsletters or news flashes, to make sure that we are including those projects that are relevant outside of the program as well. And also working with the other SPHR networks, so the Health Economics Network, HERICOM, and Natural Experiments. Forgive me if I've forgotten one of the networks. And just to give an example of how that works in practice, so recently the Public Mental Health Programme had their annual symposium, and what they did is invite all 4 research programs to be represented. So they looked at where the crosslinks were, they invited projects that were relevant to their programme that are in other parts of the school. So children, young people and families were in the morning, alongside 2 other public mental health projects and the lightning talks from other PhD students. And Healthy Places, Healthy Planet and Health Inequalities featured in the afternoon. And after each session, they had a discussion, so they was able to share learning and cross-collaboration work across the school on the theme of public mental health. For the economic analysis work, where we started was to sort of mine the project proposals that were put in for the programs to look at where there were health economic analysis work packages. So we had 5 projects that had clear economic work packages. For example, Heather Brown's leading some work on expected value of sample information in the Food Insecurity and Pregnancy project in CYPF. But there were another 3 projects where it was slightly less defined, but there was potential for economic analysis to be there. So the examples of these are the cross-cutting data program, where there is potential to look at economic analysis, and Latif will actually be talking about some economic analysis in the next session. And then 2 projects in health inequalities, so growth and systems, where the aim of the project could actually include economic analysis. So where we're going with this is to work with the economics network to assess areas where economic analysis that might be feasible in other parts of the programs, and discuss with the project leads where there might be potential for additional analysis. And we're hoping to have one health economist to act as an advisor to the programs to look for those potentials and different areas of including more economic analysis in our programs. But thank you very much.
So Thanks to Kiya and also to the other research associates and the postdoctoral research associates who've really embraced this challenge. And I think it's that complexity of we are a large school, and it is complex, and 9 members and spread out, but thinking about how we share that learning from the different programs and also the methods that we do. And I think you've given some great examples there of how we're using similar methods, and there are many others that we can bring that together and look at how we're approaching similar issues using similar methods. So a really useful exercise, and it's the beginning, and really encouraging us to think about those cross-linkages, which is an opportunity for today and tomorrow as you hear about the programs. If there's things there that you think, oh, that's interesting, I'm using a similar method, or that's interesting, I'm working with a related group and I'd like to talk with those researchers. That's what this is all about. And so we're going to have opportunity to hear a little bit more detail about what's going on in those programs. But please, can I encourage you to then take opportunity to talk to the people presenting and to think about how what you do links across with that. So I'm going to introduce Peter Craftnell. Peter is the program lead for children and young people. I'll just bring that across. I don't know whether you've got your name on there. Just check. There we go. So Peter is the lead, along with Dougal Hargreaves, for children, young people and families. Dougal is currently somewhere, stuck on a train somewhere. And I know many of you will sympathise with that. And so you can all sympathise with Peter, who's now going to enter the hot seat because Dougal is probably in a hot train somewhere trying to get here, and he'll arrive at some point. So Peter, over to you.
Thanks, Ashley. Good morning, everyone. Yes, I can, as a geographer, I can put a bit more specifics on where is Dougal. He's somewhere between Coventry and Northampton at the moment. And hopefully we'll be here right at the end of our session because he will be sharing a video with you based on some of his recent work. So I'm one of the 2 co-leads for this Children, Young People and Families programme, and I'd like to give just a very brief overview of the programme, some of the component parts of the programme, and particularly how we've been communicating the different aspects of our programme and working together before we hear from some of the projects that comprise the Children, Young People and Families programme. So our programme is, as you've already been hearing from Ashley and from Kiya, underscored by a focus on equity, on social justice, and also including children, young people and families through public engagement, through co-research and the co-production of knowledge. And whilst we have 3 strands, 3 work strands, WS1, 2 and 3 that you can see on the slide there, the programme is also underpinned by that commitment to public involvement and engagement. As well as that, we have a cross-programme linkage project which looks at data linkage, particularly of large-scale data sets from a range of different sources, which Dougal and a number of you in the room here are involved with. Just to give you a flavour of the 3 work strands, the first explores how social and environmental determinants of health affect the lives of children, young people and families. And projects there include a focus on housing insecurity and on physical activity. In the second work strand, there's a more determined focus on the early years and also on pregnancy. And we have projects focusing, for instance, on food insecurity. The third work strand looks at educational environments, predominantly, but not only, school environments, and again at the role of physical activity and also, for instance, the holiday activities and food programme. The other important thing to note here is that we're not only interested in the early years and in children in middle childhood, but also in older young people. So the programme is interested in children, young people and their families across that early phase of the life course. So we wanted to flag some of the ways in which we've been communicating and collaborating across our programme. And if you'd like to know more about these, or you'd like to sign up for any of our workshops or our newsletter, please approach myself, Kiya, Dougal when he arrives, and we can ensure that you're included on our mailing lists. So the first way that we're sort of communicating around the programme is through the newsletter, which Kiya brilliantly brings together. And this is open to everybody, not only to researchers specifically identified as being part of the Children, Young People and Families programme. And in that we have various updates, pieces written by our members, links to events, the kinds of things that we've been reading, and a whole range of different things. We have quarterly seminars at which we have updates from our different projects. We also use those as an opportunity to share questions, challenges, and issues that people may be facing in their projects. And later on, we'd like to use that as an opportunity to bring together the strands in the programme and indeed the programme itself, for instance, with a view to potential impacts and knowledge exchange. And finally, we have an annual in-person meeting, the first of which was held at Imperial in November last year, and the next of which will be held in Sheffield. And again, that's open to all, not only people who are specifically identified as part of the Children, Young People and Families programme. So I'm not going to say too much more other than to say that the presentations that are going to follow are going to give you a more detailed flavour of those work strands and of our projects. So we've decided to introduce a couple of props, as you'll see, into our presentations today. The first of which will be that rather than me intervening when speakers have 1 minute left to go, Kiya has a bubble machine to introduce a bit of levity into proceedings. So speakers have been forewarned about this, so we will use that when there's about 1 minute left to go. The other thing to say is that I'm not going to come back onto the stage to introduce each of the speakers, just to ensure that hopefully we have a bit of time at the end and to ensure that speakers have their full allotted 10 minutes. So if perhaps each speaker could just very briefly introduce yourselves if you weren't planning to do that, then we can move through the programme and hopefully have some time for questions before lunch. So without further ado, I'll hand over to Latif, who will be giving our first presentation. Latif.
Thank you, Peter, and thanks, Ashley. Thank you, everyone, for having me. I'm Latif, and I'm very new here. I joined Liverpool as a postdoc about 8 months ago, and I'm working on, as part of the Children, Young People and Families program, especially on the cross-cutting data theme. By training, I'm an economist, so I'm trying to bring in some of those economic concepts and economic models into public health, and I hope I'm going to learn a lot from you. So part of the things we do in Liverpool, and as everybody has been saying, our interest is to look at those intergenerational inequalities in health, trying to see how inequalities in one generation, the social determinants, and how that cycle continues. And our interest is to understand this cycle and find a way of recommending policy, putting actions in place to break those cycles. And as so many people know about this rainbow and this model, there are 3 aspects of our work. Like as Peter also said, I have a colleague and colleagues who are working on the environment aspect. I have colleagues who are looking at the healthy start to life and other social determinants of health. And today I am interested in the education aspect of things, and I'll be talking a little bit on one of my ongoing work on how inequalities in school funding is currently prevalent in England, and digging into that further into how that could affect series of public health outcomes, especially coming from education outcomes and looking into different health outcomes across the country. So as a bit of background, we all acknowledge that education is an important investment and a key determinant of health. Coming from school-based intervention, there had been a lot of discussions around that and a lot of evidences on how intergenerational inequalities also speak into health. Maternal education is an important factor. There's a Lancet article recently, and the finding in that article in brief, is that every year we spend in school increases our life expectancy. That's to tell you that investing in education is as good as investing in our health. And also, education in England has been in the news very much lately. Number one, in the last few years, there was this national funding formula where the government introduced, and the story behind that was that we are trying to build inequality in school funding in England. How equal is that policy? Part of these things, we are going to be looking into that, if not today. Then there's also the crumbling schools. We all heard about schools that are falling concrete across England. Also, even during the pandemic, school was in the news. There was homeschooling. We have spent billions of money into education. How useful were this spending? We'll be looking into that as part of this project as well. So these are some of the reports and different news of how schools have been, education has been in the news. Some of which, I don't think any of this news is positive. Secondary school with poorest pupils facing biggest cut and some of this kind of news. So for today, what are the research questions I'm trying to address? The first one is to look at what are the systemic patterns in school spending in England, and can we pick up any form of inequality, especially across deprivation, are rural schools better than urban schools, and what is the influence of local government structure? Because we know there's unitary system, there's two-tier system. Education funding is a little bit complicated in how local authorities allocate money. So we want to look at, can we unpack some of those things in terms of the inequality? Also, we'll be looking at the effort schools are making on their own to generate funding. Schools are now under a lot of pressure in terms of raising self-generating funds, renting out their premises, seeking funds from parents and alumni to meet up some of this spending obligation. Then there's also funding deficit aspects to all these things in terms of every year school have to overspend. By the time they get their grants next year, they have to pay up their debt first before getting into the annual spend. Then lastly, to look at some before and after analysis of the national funding formula. Has it really improved in terms of what schools are spending, or has it declined? For the data and method, which is where the work is, because it's about cross-cutting data and getting data. So the data we used for this analysis was to go into every schools in England, their annual reports, and extract the expenditure item from there. So rather than using we've spent this amount of money across local authority by the government from the Department for Education, we go to the spenders. This is how much the school are reporting they spend. So collate all these things across all schools in local authority, across different school types. Both the local authority maintain schools and the academies. We know where the academies are located. How much is this academy spending in every school, in every local authority? We extracted information on self-generated funding and what is coming from the government. Aggregating this together using the postcode information of all the schools, we know where they are located, so we can match them to the local authority where they are spending that money. So that will give us how much is actually being spent across local authority. Then we try to use some economic, deflation to know what is the real spending by schools, not just the figures that we saw. So in terms of method, I won't take so much time here. It's just some trend analysis using some charts and plot to see how has this spending been moving over time. So for results, the first thing, this plot is just showing us a chart of how average school spending across all schools in England has evolved over time. So the data we have access to was between 2015 and 2023, and we could see that before the pandemic, it's been declining. During the pandemic, we saw some form of increase and stability. Well, one thing that could explain this was, there was COVID-19, government spent some extra money because this is the total spend by school, and it's almost the same amount of money spent. In 2023, the last one that was released, there's a little bit increase. This is average spending per pupil. I need to mention that. So on average, every pupil in England, this is how much was spent on that child in a year, and we saw how it has been over the years in terms of the trend. Secondly, we look at relating this to what schools generated on their own. We could see that why the spending is declining, self-generated funding percentage of that expenditure is actually going up, except for 2021, 2022, where schools are actually shut down. Maybe they couldn't rent out some of their facilities, or they couldn't get some of the funds they rely on. So it's been why school spending was declining, self-generated funding was going up. And what that will tell us is that what is actually coming from the grants or from government has been declining. That's what it means. Because your spending is going down, what you are generating is going up, then what you are getting from the traditional source of your spending is actually declining. Then we broke this down to look at the relative spending between the first period we have, 2015, and 2023. What does it look like across different deprivation quintile? So we just try to look at different local authorities and index of multiple deprivation where they belong. And what we saw is that schools in most deprived areas actually has the biggest decline. So in most deprived areas, spending actually has been declining more than in least deprived areas. It also tells us that there's some form of deprivation aspect to declining spending, while in terms of recovery, we saw some recovery when we unpack it between primary and secondary schools. Secondary schools are more affected. And let me just touch on something here. The reason why we unpack secondary from primary is because secondary schools seems to be the transition phase. Whatever outcome you have at secondary school will determine whether you're going into further education, whether you're going into employment, and whether you're going to anything. We have another work we are doing looking at the student destination after key stage 4 to see what is really happening with these pupils. And it's another thing we'll be presenting in future sessions. This is something on school deficits. The number of schools with deficits also is more in deprived areas. So the most deprived areas has more schools with spending deficits. It's also telling us that while spending is declining there more, in terms of deficits, they're actually having more impact. So briefly, this is a lot of numbers here, but what we are looking at is just to look at that trend in statistical terms, that by how much has spending actually declined. What we are saying is that on average, most deprived schools over 9 years between 2015 and 2023 per child, it has actually declined by about £240. And thank you for the bubbles. So then briefly on this, okay, let me skip to the national funding formula. This one, I just separated the analysis into periods before and after. And what we saw was that throughout the period before NFF, it declined across all schools, across different categories. Schools in London had more decline. But when the NFF was introduced, between 2018 and 2023, including COVID spending, there was increase. We need to acknowledge that. However, the level of increase has not even met the kind of decline that happened 3 years or 4 years before the NFF. Adding the COVID intervention, the amount of pounds that went into COVID intervention into that, it means by the time we exclude COVID intervention, schools have actually been faring worse than where they were in 2014, 2015. So in terms of the insights, what this has shown us is that we are picking some form of inequalities. Some reports have shown that. We are also seeing that using school-level information, we saw some improvement after NFF, but spending deficit is going up. Self-generated funding is also going up, which means schools are taking on extra mandates beyond just teaching the pupils to look for money to meet up their expenditure obligation. Then the question we ask also is, with this level of increase that we've seen, post-2022, after the COVID, are we going to go back to COVID situation, pre-COVID situation, now that there's no COVID intervention fund again? So the next thing we'll be looking at is to take this spending data forward to now bring in some education outcomes and some public health outcomes to see what is the association between the two. Thank you, and thank you to all the partners that we are working together on this.
Great. Hi, everyone. So my name is Bina Ram, and I am one of the co-investigators on the health and activity of pupils in their primary years, also known as the HAPPY study. So first of all, I'm just going to give you a bit of background to the work that we're doing, and then I'm going to focus on some of the collaboration, co-production, and public engagement work that we've done. I'm too short, aren't I? Yeah, I should have worn my heels. Thank you. Great. Okay, so firstly, I just want to acknowledge the team that we're working with. We're very much a collaborative working team. We're working with universities of Exeter and Cambridge, and also colleagues from Fresh and Fuse as well. I've seen some of you in the audience today. If I haven't said hello, sorry, hello. Great, so just a bit of background first. So children aged 5 to 18 years, it's recommended that they should engage in at least 60 minutes of physical activity a day, 30 minutes of which should be during the school day. But actually in England, under half of children actually meet those recommended levels of physical activity. So pre-pandemic, it was less than half of children in the UK reaching that recommendation. During the pandemic, as you'll know, it dipped because there was less opportunities for children to be physically active. But what happened as we were coming out of pandemic is that number has increased, but what it's done is it matches what it was pre-pandemic. So we still haven't increased, it's still matching exactly the same. So schools can be ideal settings to promote physical activity amongst children. Not only are you approaching a large population group, but also schoolism is compulsory for all children in England, so you're reaching most children through your research. And also the school environment can encourage children to be physically active as well. So the World Health Organization, they've actually produced a schools toolkit which recommends 6 domains for schools to encourage children to be physically active. So the first one is quality physical education, and that is PE taught through a specialist teacher. We have active travel, opportunities to be physically active before and after school and during breaks and lunch. Active classrooms, you might have heard of classroom movement breaks, and that could be asking a child to jog on the spot whilst they're working out a sum. And also making sure that it's inclusive, so those with special educational needs are not left behind. So with all this in mind, the aim of our study was to identify how active are school environments, how much do they encourage children to be physically active, based on those WHO guidelines. And we also want to find out whether those opportunities for children to be physical activity are actually being taken up by them. So to do this, our methods are including a school survey to identify the policies and practices that schools have around physical activity. And simultaneously, we're carrying out a cohort study to examine whether children in those active schools are taking up those opportunities to be physically active. And we are assessing that against 3 outcomes: their physical activity, mental health, and educational performance. So the measures we're using to assess the school environment, it's a survey that we're doing, and then physical activity is being measured objectively through a wrist-worn physical activity monitor, which we've tried and tested in the population group before, and it's worked really, really well. Mental health is reported by parents, and then educational performance is going to be reported by teachers on age-related expectations on reading, writing, and maths. And what we're hoping to do is we're hoping to influence whole school physical activity approaches to encourage children to be physically active during the school day. If we can embed those healthy behaviours during childhood, we're hoping that they can lead into adolescence and into adulthood as well. So a few study milestones and progress we've got to date. So since we were funded by SPHR in June, we've appointed a research assistant. We've developed our study materials and protocols, and we also had our ethics applications submitted and improved. And in the progress we're making today, we don't have any results because the studies are still ongoing. But our school survey has been distributed just under 2,000 state-funded primary schools in Greater London. Currently, we have a 5% response rate. We are actively chasing and reminding schools to try and complete our survey. And then with our cohort study, we have recruited a number of schools, and just over 750 children have been invited. And as expected, usually half of those invited tend to take part. So we have just over 300 who have consented and being assessed. Right, so I'm now going to move on to a bit of public involvement and engagement that we've done. So the first thing we did was trying to come up with a study name. There was lots of things flying around the table. Some were probably not appropriate to put on these slides. And so we whittled it down to 4: Happy, Champs, Chase London, and Ease. And this was put up on social media by the study PI, and the name Happy was born with 45%? Yeah, 46% of the votes. We decided with Happy. So that was very much a social media input into deciding our study name. We also have a study website, not quite live yet. There's a few technical issues, so don't link on that just yet. But our study website has been designed to be appropriate for schools and for parents as well. So it's where they can link in and look at some of the information leaflets that we've put together as well. So the next thing I'm going to talk about is the school survey that we developed. This was based on the WHO guidelines, and we wanted to make sure that we were capturing what we wanted to find out, whether the schools are promoting active environments. So with the help of our co-investigators, most of who are either leading or involved in previous studies based in schools, we used questions from questionnaires including Speedy, Waves and Go Active, which already had questions that were very much related to the WHO's domains. So we extracted some of the questions, being very mindful that this is teachers' time that we're asking to complete this survey. So we ended up having quite a long list of questions. So what we then did is we invited teachers to comment on our survey and to feed back. We were very keen to co-produce this questionnaire with them and what they find easy to fill in as well. We also wanted to find out how long it would take for them to complete, easing of word, and also whether we were providing enough response options. Most of the feedback was quite positive, and that's because a lot of our questions were taken from previous questionnaires, so we know they had been tried and tested. But we did get some feedback to say, some of your questions are really wordy, can you simplify them? And also anything that we were missing, that we were not capturing, they asked us to include that. So with them, we then developed our survey, we created that, and that's the one that's been distributed to all primary schools in Greater London. The next thing I wanted to talk about is a school assembly that we did. So there's a school in northwest London that I've been working with over the last 2 years. It's an area which is very, very diverse, and this particular school, a majority of their students don't have English as a first language. So this school I've built up a really nice relationship with over the last 2 years. And the head teacher invited me back to give a school assembly to reinforce public health messaging on physical activity. So what we did is we designed our activities. We actually asked the school to invite the parents along too, because it's really important for parents to also understand those physical activity messages. And also understanding that it's not just physical activity that we're trying to improve, it's the links with the mental health and improving mood. And also, obviously, it helps with building the strengths with the school. So here to tell you a bit more about it are the children themselves.
Up next, we had our fitness assembly on Tuesday by some scientists from Imperial College University. That's right, this scientist taught us the importance of exercise and how it makes our bodies and our minds healthier. We even had a whole Key Stage 2 game with Simon Says. Imperial College London have asked us to complete some homework on how we stay active at school and at home. It is really important that we all do this homework, as it is part of their scientific research. Imagine that, St. Bernadette's being part of an important science research project. It's marvellous! Here are some pictures of our very active assembly.
Okay, stop there. So there's one quick story I really want to share about that particular assembly that we did, because it was learning for me as well. So when we were invited to do this assembly and we were designing what activities we should do, I asked the school whether there were any children that might be wheelchair users, because we wanted to make sure that we were including everybody. But what I didn't ask, rightly or wrongly, was whether there was any children with special educational needs who might be able to take part. So we did the assembly. As you can see, they're all buzzing, they're all laughing. And then at the end of it, the deputy head came to talk to me, and I felt I was in trouble. But she said to me, they have quite a few children with special educational learning needs, and she's never seen them take part in an assembly the way they did with ours. She said they all joined in with the activities, even some of them put their hands up when we asked the children for any questions. And she thinks it's because we didn't know. She thinks it's because we were treating them exactly the same as the other children. They were within the groups, and the fact that they were able to do that. It's just really nice to hear that from a teacher when it's coming from the very population that you're trying to target. So that was really, really lovely. And I'm running out of time, so I'm going to quickly go through the dissemination that we've done. So our early findings on our school survey from the schools that responded so far, they've been accepted as presentations. We've got a poster here today. We're presenting at the Whisper conference next month, and we've also got an abstract accepted for the Socks of Med conference, and we've also submitted to the UFA as well. Our school assembly has been written up as blogs promoted by both the SPHR and also the ARC Northwest London. We presented a lot of our engagement work with schools last week at an ARC learning event, and any of you know about Imperial's Great Exhibition Road Festival. It happens over a weekend in June, and that opens up all research to the community. They picked up on our assembly and they didn't invite me, I think they roped me into presenting exactly the same assembly to the Children and Families Zone, which will take place in June. And then our next steps, very quickly, so our data collection continues. We're going to be publishing our study protocol, hopefully before the end of the year, and hopefully also write up our school survey results, and continued public engagement work throughout our research. That's it. Thank you.
Hello everyone, my name is Kerry Brennan-Tovey and I'm a researcher at Newcastle University working on the Poverty Proofing Maternity Care Project that's being led by Dr. Rice Aquino and Professor Judith Rankin. So first off, I would like to just introduce our research team. So this is another collaboration. We at Fuse based at Newcastle, but we also work with Lilac, Fresh, University of Bristol, and we have policy partners from the Office of Health Improvement and Disparities as well. I would also like to mention, though, that we also have a lot of input from other organisations, such as the local maternity and neonatal system, North East North Cumbria, our Integrated Care Board, North East North Cumbria, Children North East, and the Newcastle upon Tyne Hospitals Trust. So before I get into the project, I just wanted to provide a few little updates. So having had quite in-depth conversations with our public involvement and engagement network, who felt that the term poverty was quite stigmatising and were unsure as to what poverty proofing meant, with their help and their involvement, we have come up with a new study title known as SEAMS, which is Supporting Engagement with and Access to Maternity Services. And they've also played quite a key part in our logo development as well. Alongside this, we have also developed a study website, which there's a screenshot there. So this website is live at the minute, and it does contain information about who the research team are. There's information about what the study is, but also has information specific to the professionals that we wish to recruit, the pregnant women that we wish to recruit. And we'll keep this updated with study materials as the project progresses, and we will be uploading some lay summary bite-sized videos in the coming weeks as well. So a little bit of background about the study. So research has shown that women living on low incomes in England are at an increased risk of experiencing poor health during their pregnancy, and they typically do not engage with maternity services well during their pregnancy. And this can have an impact on their pregnancy outcomes. So there's often a high increase of stillbirth, low birth weight, and babies being born early. A recent Embrace report has shown that women living in the most deprived areas that face multiple deprivation are amongst the women that face worse health outcomes during their pregnancy. I also wanted to provide a little bit of context as to what poverty proofing is and why we'll be using it in this study. So poverty proofing is an approach and a concept that was developed by a North East charity called Children North East. It was originally a concept that was used to poverty proof the school day, which was, as I said, an approach that looked at all the barriers, policies that were in place that prevented children and families living on low income from engaging with their school. So we'll be using a similar approach to see whether or not we can poverty-proof maternity services for women on low income to ensure that they have the best access to maternity care. So to do this, our study aim is to explore the barriers to accessing maternity care services for women living on low incomes and identify a range of practical actions and solutions to help improve this access. And to do this, we do have 7 objectives, but I'm not going to go into too much depth with them right now. I'm going to flick over to the next slide where we'll outline how our work packages interlink. So the first work package is work package 1. So here we'll be mapping all the maternity care services that are both VCSE organisations and NHS services that are available to women in our geographical area who are living on low incomes. Once we have completed this element of the study, we'll be sharing these findings with our collaborators in Lilac, Fresh, University of Bristol, so that they're able to conduct similar studies in their own context. After this, we'll be conducting interviews with professionals, those that work in the NHS and in VCSE organisations, with women that are living on low incomes about the barriers that they perceive women are facing when trying to access maternity care. Following this, we will conduct interviews with pregnant women and their partners, if they have one and would like them to be involved, about the barriers that they have faced when trying to access maternity care. Alongside this, we'll also be conducting a cost analysis survey of the costs of accessing hospital-based antenatal care for pregnant women living on low incomes. Work Package 5 will bring all of those findings together, where we will develop a toolkit of practical recommendations and solutions, and we will share this with our practice and policy partners. And then Work Package 6 will be sharing all of these findings with our PPI groups and our collaborators in Lilac, Fresh and University of Bristol. So where are we up to so far? Regarding Work Package 1, which was that mapping maternity care services, we've received ethical approval from Newcastle University, and we have been working with VCSE organisations and our NHS maternity services to identify all the services available to our geographical population. So far we have identified 66 VCSE organisations, that 45 of those meet our inclusion criteria, and from those 45 we have data extracted from 22. 3 have been excluded. It is worth noting that these are only VCSE organisations that are at a local level. We still, the next stage will be looking at VCSE organisations that are on a national level before we start looking at our NHS trust as well. So this piece of work is ongoing. So Work Package A and B, which was the interviews with professionals and with pregnant people. So the main focus on this bit so far has been the development of our protocol and our study materials to get ourselves ready for the NHS ethics and sponsorship application. So whilst we've been using this time to develop our study materials, we have been working really closely with VCSE organisations and our NHS trusts so that we have the groundwork made, so when we do have ethics in place, we'll be able to start recruiting quite quickly for both professionals and pregnant women. Work Package C is the cost analysis survey. So this is a modification of an existing survey. So we've just modified the questions to ensure that they're focused around accessing maternity services. And questions will include the cost of travel, the cost of parking, cost of tolls. We've also added additional questions such as the cost of food items for pregnant people and their support when they're attending appointments. Again, this part of the work is also part of our ongoing NHS ethics. And I also wanted to briefly touch on our public involvement and engagement so far. So we had a PI&E network involved during the application stage of this project, so they were quite key and instrumental to the development of the project. All of those that were involved in the application have very kindly and very generously continued to work with us as we have been funded. As I have said, we are working really closely with a number of organisations in our area to not only recruit additional PI&E members, but also to recruit community experts. And we will continue to recruit PIE members, throughout the duration of this project due to the changing landscape of maternity. We want women to be able to come and be involved as much as their capacity allows. So far, our PI&E involvement have been involved in our protocol and study development. They have helped us involve in our protocol, study materials. They've piloted our survey and our topic guides and provided detailed information on changes in which that they would like, such as including questions around income. Instead of having an annual income, instead I have a monthly incoming instead. They were very involved in changing our study title, that I've already said, and involved in our logo. So going forward, our PI&E involvement is going to continue. They'll continue working with us for our sampling criteria and our recruitment strategies and our data collection. When it comes time to analysing the data, we will run analysis workshops and theme developments for those PI&E members that wish to be involved, and there will be training provided to those as well. Our PI&E members will also play a key part in our dissemination activities to ensure that we are able to disseminate our findings to our VCSE organisations in a way that would be beneficial and impactful, but they will also be named on our conference submissions and academic papers if they wish to as well. So our project's next steps. We will unfortunately be continuing with sponsorship and NHS ethics, which is taking some time. I'm working on Work Package 1, making sure that we capture those national VCSE organisations and NHS organisations. Once we do have ethics in place, we will be then recruiting our professionals to interview, recruiting our pregnant people to interview, and recruiting our pregnant people to complete the survey. And that's everything. Thank you.
You're right, it is scarier up here. Hi, I'm Sarah Martin Denham from the University of Sunderland, and I have Hurley with me, who is delighted to be here today as part of our PPIE award that we got of £3,000. So, yeah, so we're here. So I was sent an invite saying, who would like to come to Birmingham? Not, would you like to come to Birmingham? So Kiya Hurley was nominated before seeing the WhatsApp.
Before I even saw the message,
Yeah.
was nominated by the others.
So yes, so thank you for coming.
Yeah, my welcome.
Okay, I'm here about Project 2999. And, oh, it's down there, but
Down
yeah,
there.
Project 2999. So how it all started, do you want to say how this all started?
Yeah,
Chair.
so as you can see here, hashtag pull up a chair. What it was is I was asked as a parent to come along to a session where I could talk about how my son's education had been impacted by exclusion, basically. So, yeah, it was just come along, share your experiences, share your how it's impacted your family, how it's impacted your child, and obviously how it then impacts other kids within the school environment. So obviously my child being excluded then sends a little bit of a ripple effect through the mainstream school that he was in at the time. And then that obviously impacts his then behaviour. It then impacts his behaviour at home. So it was just a really come along and have a chat.
It was a lie.
It was a lie. One of the parents was promised a massage.
They were
I was
promised a
not,
massage.
because I don't like being touched, but yeah.
They're still waiting.
They're still waiting, yeah.
Yeah, so Pull Up a Chair was exactly that. So it started with me working with, I do research on school exclusions. I spoke to about 500 children and parents. In addition to that, probably lots of professionals as well. Yeah. And I've written loads of words, which lots of you do. And the people who read the words, I need to be really careful because this is a room full of academics. I felt like words on a paper, although they were child voice, parent voice, it's a bit dull, sorry. And I wanted to, that's really offended so many people in the room, that was really bad. I didn't mean to offend anyone.
Other people have said that before you, though.
Yes.
And done tube charts and stuff. So.
Yeah, what I mean is, by seeing a child or seeing a parent talk to camera, there's something very different about that. So Pull Up a Chair started, worked with about 130 children in various, through art projects, through the creative arts, but Pull Up a Chair is a film. So if you type in Pull Up a Chair, University of Sunderland, or Sarah Martin Denham, University of Sunderland, Pull Up a Chair will come up, and the children named it. And then one of the parents designed the T-shirt. So that's why it's called Pull Up a Chair. And Pull Up a Chair is really about listen. It's just the word listen, isn't it? It's like, hear my story, find out about my experience, which is where it came from. So the children did a Pull Up a Chair series, not 130 of them. There was about 20 that took part from 5 years of age to 16. And then I thought it'd be really interesting to do the same with parents. And you were invited for the 5 days with a filmmaker to come in, a filmmaker and myself, and a filmmaker, theatre maker, myself, and a group of about 8 parents. So we did a Pull Up a Chair with that. And then it came to the end. We'd produced 8 films together, freely available, so you can all use those. And then I think it was Hurley, you didn't want to stop.
Yeah.
So we wanted to keep meeting, didn't we? We did want to keep meeting because it had become a bit of a therapeutic type, informal, very informal support network where I mainly bring snacks and creative materials.
Should have had my snack T-shirt on.
Should have had we have a snack T-shirt as well. Yeah, so we started having these meetings and it led to this. So 2999 is the number of children suspended or permanently excluded each school day in England. That is 21-22 DFE data. And we were a bit staggered by this. We'd done Pull Up a Chair, we'd looked at the number and we were like, hang on a minute, that's considerable. And then we knew about the impact from the film. So when we meet on a monthly basis, I take snacks and the creative things, and I'd take crochet hooks, and I'd taken some wool, and Karen, who is queen of crochet, made a square. And I can't remember whether it was me or Karen. I can't remember.
You.
Probably me. Over-ambitious at the time. thought, how can we represent these children in a visual form? Because I like the visual more than the writing. At that time, I was in communication with Peter and Dougal about on the SPHR, Children, Young Peoples and Families, and was very kindly, wasn't kindly because it was through a process, secured £3,000. So let's see what us Northerners have managed with 3K. Right, we might need some help. So we started to decide we'd make a blanket to represent. Please do not put this on social media yet, because it's not out there. This is only 600, so each one of these represents each one of the children. They've been donated from Europe, England, Wales, Scotland. That way. So it will be, the final blanket will be, who's good at maths? Where's the economist gone? This is 600, it's going to be 2,999. But if you think that's each school there. I'm actually shivering. Isn't that a weird response? I hope you're all okay.
One more second.
Pardon?
I jumped in to help you, didn't get your social media post.
Oh, yeah, don't put it out yet because it gets launched on the 27th of June, so no one's seen this yet.
So essentially, this is only a fifth of what it's going to look like.
It's
so,
a day.
And it is so heavy. But however, the burden of what's happening to these children is also just as heavy.
It's very heavy, and it's. Oh, I have a really weird
It
reaction.
is pretty fragile as well. So I mean, in the process of us bringing it here, we have had to repair some squares, which if you think about the system and the children that are being excluded or suspended from school, a lot of these children are being suspended and excluded multiple times. So they're in there like multiple times. So one child could be excluded from school 6 or 7 times before they're permanently excluded and end up somewhere like a pre-school.
Yeah.
And the representation really of how fragile the blanket can be is that they will need repairing. So do these children. And how many times could you repair a child before the resilience is gone? So, sorry.
No. And we're talking about children from 3. Oh, don't you set me off as well? From 3. We're all right, okay. Yeah, so we didn't realise at the time, we were amazed, these are all donated squares from all over the place, and then we got them together and thought, oh, we'll just sew them together, we'll just put them together. You can't do that because some people knitted, not crocheted, some people didn't follow the brief at all and sent 14 centimetre squares, not 10 centimetre squares, so I had to border each one in orange. 4 of us have done that, 3 parents and myself have done that, each square 2,999 bordered, and then you connect them, but you get straggles of wool, and then one in the middle is back to front. Or I couldn't crochet also, so it's been. But when you're doing it with people, there's probably about at least 150 people in the public involved. Yes, so I'm going to quickly move on because it's very emotional. So the BBC Look North came and covered the story. I was going to show that, but I don't think how many minutes? 2 minutes. We'll send that out to you. BBC Look North came, so we're really happy to have it on there. And Karen and Paul are 2 of our parents, and I think it's probably more important to show this than the last slide because this is another parent's views about the impact of health. So let's have a...
Are there any changes that you would like to see in the referral process?
If I'm being honest, there needs to be a massive shake-up because it's not acceptable to allow children 3 years to cope and manage and fend for yourself. Families are in crisis, and it has a strain on every single, so not only that one child, but that one child has the educational problems and they have the welfare problems, social service problems. It's a strain on every resource. So them time scales need to come down. If a child is thought to have SEN and needs a referral, it should be dealt with a lot quicker than what it is.
Yeah.
If a school's asking for help,
Yeah.
the help needs to be there.
Yeah.
Even if it's just somebody stepping in and looking at the place with a fresh pair of eyes, and give the school some kind of input on how to cope would be better than nothing.
Yeah, so like they say, oh, well, we've got a 6-month wait list, but in that time, we'll triage you, you know, and see, you know, if you're coping, if you're not, get back to us sort of thing, and we'll put you on the waiting list. But if a school is screaming out for help, there should be someone that can actually go, right, that's an emergency, we'll go and see that child, see if they can go on the wait list, or see if we need to intervene now, rather than when it's too late.
So that's, sorry, this is a really short bit of time. So really important views, I think, that have come through this, isn't this space to share on a monthly basis. So the next stage for us, I don't know if you can see there, school exclusion rates. For the following year, we don't have summer 2023 out, but if you look at spring per day, 4,524.
There will be no more crochet.
There will be no more crochet. We will do another project to represent that number for next year, but it's, as you can see, this has just got to a space where we cannot carry on like this. Please, if you can, if you're free on the morning of the 27th of June, you can join remotely to this Pull Up a Chair conference and see the blanket in full, and also another film on factors that impact attainment, which is the next Pull Up a Chair film. Thank you, Hayley.
Thank you, Sarah.
Thank you, Brenda.
Thank you. How do you follow that? I've got no blankets. That was incredible, Hayley and Sarah. Thank you so much. That was amazing. Apologies, I've been slightly late, so I'm not entirely sure how the kit works.
What would make you want to get involved? Okay. Like what might be an incentive?
Sorry, my name's Duke Hargreaves. I'm co-lead for the programme, and it's great to see you all today. I'm presenting just very short today. I think I've got 5 minutes, if that's right, isn't it, Kiya? So I will be very, very quick. To talk about some of the patient public involvement work we've been doing in North West London with support of SPHR, and a little bit about what the next steps will be, and to kind of how that's influenced different bits of work, both within SPHR and within other funding streams. So just a few of the logos there. This is work that we've had ongoing with about 7 or 8 partners across North West London. Probably 3 of them more focusing on the young people's side. So the Acton Youth Association and the White City Youth Club and the Nova Club are very much getting the kind of adolescent and young adult voices. Then a number of groups taking more the kind of parent-carer perspective, so the Mosaic Community Trust, Wealdstone Baby Bank and the Nova Club. And then a couple more from the kind of the research infrastructure side. So Ealing and Hounslow CVS, Community Voluntary Services, have much more experience working with research. And Listen to Act is a youth, young person's advisory group, which is through our ARC mental health work. Kiya, sorry, am I clicking? How do I get the video? If I just press this, will it work? Apologies. Maybe I'll just talk through this because I think we've probably got 2 minutes. So, Katie, is it possible? I'll just talk. If it is possible to get 1 minute of it, then that would be fantastic. Otherwise, I'll just talk through. So in the top left, there's a video called All the Stressors. This was part of, similar to the one Sarah mentioned. This was a small grant of around £3,000 from SPHR, and it was co-supported with some local funding. And we did some work with a Year 5 group in a local primary school over about 6 months. We worked with the White City Youth Club, and we worked with the sixth form college that was kind of a more apprenticeship technical college perspective. And we got some fantastic, really hard-hitting stuff that I have presented at the exec meeting, so some people may have seen it before. Please do look on the website if you're interested in seeing the full video. But they really challenged us on 2 things, I think, that really made a difference to us. One was linked to what Sarah and Hayley were saying, a really strong voice from young people saying, our experiences at school make us feel alienated, make us feel that we're not listened to by the adult world, make us feel that if you want to come and talk to us about our health, please kind of start from where we're coming from, which is where we feel that we're not included. No one's very interested in what we're doing until we're harming other people, until we're causing problems within the A&E department. So I think some of that was within schools, and that's really influenced a project in the top right, which is within our Children, Young People, Families programme, the cross-cutting data programme. Hannah Crease, who can't be here today because she had a baby about 3 weeks ago, but is doing a nice bit of work, data linkage work, looking at links between school absence, school exclusion, and physical mental health outcomes. And we've got a similar bit of work more early days, looking at mental health crisis admissions within the NHS, which is a huge issue for the NHS locally, but how we can take a more upstream approach to that, instead of just looking about what happened within the last month and could you have seen CAMS a bit quicker, which is definitely part of the problem, but to take 5 years back, over the last 5 years, what were your contacts? What were the first signs? Maybe you were missing school. Maybe there was an early help referral that didn't meet the criteria for further investigation. Maybe there were opportunities to investigate and intervene at that point. And then that's also led to some work. We got a grant from NHS England, the Research Engagement Network, to do some work a little bit more in depth, looking at what are the barriers to really representative, diverse PPIE work with children and young people. And so 2 things came out of that. One is that there was a real need. We talked to a lot of researchers who said, maybe I've done some adult engagement work, maybe I've been working in child health for a while, but I don't feel that confident going out to a youth club, going out to different groups of people to say, you know, can I have some training, can I have some support, can I have some buddying and how to do that kind of stuff well? So we have developed and piloted a 1-day training workshop. We've applied to NHS England to get some money that we will then do that as a national scale up. So if we get that money, that will be free, and it will be kind of first refusal to SPHR members. If we don't get the money from NHS England, we will have to do it on a kind of meeting our costs, so a kind of a cost neutral approach, but hopefully be able to update more on that through the newsletter and other sources within the next few months. And the other bit of work is to say, for those groups who have much more entrenched distrust of authority figures and the system in general, a 1-day training workshop is not going to cut it. For those kind of groups, we need to invest in that kind of relationship and building trust. So we're, again, co-developing this idea of reciprocal mentoring between participants within specific community groups who have that trust and that kind of status in the community, and researchers who can spend 3 months getting support to get to know each other and to kind of co-design activities and engagement activities that will be more effective and will be kind of mutually beneficial to both sides. I will stop there. Please do look at the website. Do come find me if you want to talk more about any of this. Thank you.
Thank you very much indeed to all of our speakers, and I hope that gives everyone a flavour of the breadth and depth of the work that's going on within the Children, Young People and Families programme. If it's okay, we're going to take just sort of 5 minutes or so to take any fairly quick questions. So could I just invite all of the speakers from our session, if you're happy to please come back up to the front, if you're comfortable to do so. And we will just take a couple of questions. Is there a mic in the room for questions? There is. Perfect. Great. So I'll invite any questions from the floor, please. Yep.
Well, first of all, thank you all very much for absolutely brilliant presentations, just fantastic. My question is for Latif. I've kind of got 2 questions. One is, are you able to get comparable data on private schools on spend per pupil? Because I think that would be a really interesting comparator. And the second one is, are you engaging with teachers, particularly who work in the classroom, about what that spend actually breaks down to? Because I think one of the things I certainly hear teachers saying is that less and less of it actually gets spent in the classroom on the child, and a lot of it's getting spent on things beyond that. So I just wondered if you would be able to break the data down to look at that.
Thank you for the question. First, we currently don't have access to private school data, but this is something we can explore in terms of maybe through some possible FOI request or something, working with the DFE, because there's a way private school also accounts. I don't know how detailed they give it, but we can explore that. But in terms of the breakdown, we have some information on the different breakdown. There's something from DFE. There's a standard financial reporting that every school must meet. But something I can just say briefly is that about 80 or more than 80% of the school spend is actually going into teachers' salary, and the bulk of other activities are not getting enough attention. But something we can do, we intend to publish some of this data in a way that could be accessible to people, researchers, to get different components of spend. But we can what I can say is that we didn't really look into that in this trend, but we can get some of those breakdown of the different components of school spend, especially classroom-related activities.
Just to comment on the private schools, most of them are charities, so you might be able to get data through the Charity Commission. I'm not sure about that.
Okay, like I said, I will explore that. Thank you.
There's a question at the back there, I think.
Thank you. Another question for Latif, sorry. You said that you were looking, or at least you had data on local authority maintained and academies. Have you broken down those levels of deprivation? Are they associated by school status in any way?
So let me say something. I didn't really dwell much on the methodology. There's something about an ecological fallacy because we just put all schools based on their location across local authorities. But we acknowledge that there are within local authorities inequalities as well. So one other dimension we'll be taking is to look at group schools based on the deprivation of the postcode area where the schools are located and compare even across region. So there are a lot of inner dimensions we'll be looking at, which we are not able to present here. But we acknowledge that within local authorities as well, there are level of inequalities and across local authorities. So think about schools in a deprived area in Liverpool, where I work, and a school in a deprived area in London. There are differences across their spending as well. And something I would just mention is that after the NFF, most schools in deprived areas, in urban areas, especially areas like London, were actually more impacted than schools in other areas. But we are going to unpack some of these things in the full analysis.
Okay, so we're going to take two more. So yourself, please, and then Maria. Or we'll go Marie first, and then front here, please. Thanks.
Thank you for those really interesting talks. So this is a question for almost everyone on up there, and it relates to, so many of you have mentioned children with special educational needs, and I just wondered if you had any reflections on working with that population group and how we can ensure inclusive research practice with that population group, please.
Yeah, so talking from the pull-up-a-chair perspective, I always meet with the school staff who know them best first. So try and speak to parents, try and speak to the SENCO pastoral lead in case there's any specific that you need to know. For example, there might be some children who would rather you weren't stood within a certain proximity of them, not to wear perfumes, for example, things like that you maybe wouldn't think about were important. And then also meeting with the children, I always send photo in advance so they know who I am, or a little video type film about what the project's about, and just expecting really small steps. I'd say that they've not just getting your ethics consent, but knowing that it's ongoing and I have little stop-go cards and things where they can just visually show me or pass me something rather than saying, I don't want to do this anymore. You know, I'm looking at you, bless you. Yeah, anyone else want to?
Only say we should record this and we need to get you to write that up in a blog, I think, for Sarah, because I mean we're doing similar things and I think we've had some of those same thoughts, but I think we haven't got your background in this area and I think lots of people in the public health world don't, so I think that's fantastic. Thank you.
I also feel that rather than treating all children like they're going to sit down and sit still, if you treat all children like they've got SEN from the beginning, everyone will feel included, because the children without SEN aren't going to feel excluded from that. So if you go into an environment where you've got children with SEN, treat everybody with SEN, like you were saying with your assembly. It's like you didn't have to isolate the children with SEN to begin with. You just had to make sure that you were inclusive of everybody before picking out that, you know, if a child with sensory issues needed to leave the classroom, to allow them to leave the classroom without a fuss, then that's where the environment changes. If you allow a child to be able to be themselves within an environment, you'll get the best out of that child. So if you treat every child as if they've got SEN, if you go into an environment with that attitude, that there might be a child in there that can't tolerate noise or sound or smell, or doesn't want to be touched, or might stand up instead of sitting down, and you accept that before you even enter the classroom, then the attitude towards those children with SEN, when they get excluded and isolated from the classroom because of their behaviour, will reduce. It will reduce.
Yeah, okay, so just have the one more question. Is that okay in terms of time? So if we just have one final question here.
Yeah, just a quick question. I'm Peter. I'm a public partner. I live in South London. I'm aware that the waiting time for CAMHS is over a year. And, you know, when children ask for help or, you know, it's a desperate, it takes a lot of courage, and parents as well. I mean, is that the situation across the country? I mean, it just seems quite extraordinary, really. And, you know, sadly, you know, you know, people are vulnerable, aren't they? The children are vulnerable and they need that help quicker. But is that the situation generally?
Shall I kick off on that? Yeah, I mean, it's not unrepresentative. So the Children's Commissioner did a lovely report about 12 months ago that showed the variation across the country. And in some areas, so I work in North West London, we have 8 local authorities. In Ealing, it's up to 2 to 3 years. It's not that unusual. In Westminster, Kensington, Chelsea, it's typically 6 to 12 months, which is still nowhere near good enough, but it's a very different level of need. And so we see that, I work as a general paediatrician, we see that in our clinics. There's so much holding going on elsewhere in the system by SENCOs, by GPs, by paediatricians, of people who don't necessarily have the training or the background in mental health, but are just trying to give some support to bridge until they get through to CAMHS. Equally, I think there's a lot of work to do, and this is what we're trying to do locally in North West London, is to say CAMHS, if you talk to child psychiatrists, child adolescent psychiatrists, they say there's 20%, 40%, whatever it is, of their caseload is really using their skills, and they do need to see CAMHS. There's a huge proportion, possibly over half, that actually need a bit more support of someone they trust, someone they can talk to, a little bit of earlier intervention to identify those needs. And some of that's happening in schools, some of that can happen in the social care system somewhere else. So I think it's not just part of the answer is more CAMHS, but also part of the answer is cutting off an upstream public health approach to say what's driving this in the first place. How can we address some of these upstream determinants? Any comments on that, Sarah? Or others?
It's just a long wait. I know
It's a long wait.
from speaking, it's really variable, isn't it?
It is, yeah. It depends on, because you're triaged to begin with. So if you're not deemed as need, I mean, my son was out of school for a while, lots of non-education because he was left outside the classroom in mainstream. He then went to a behavioural unit, PRU school, naughty boy school if you want. And he was there for a 12-month period, went back into mainstream, came back out, went back into the PRU, was there for another 12 weeks, and it was a situation where he couldn't go back into mainstream. There was nowhere else that would take him because the SEN provisions in my area are full to bursting, as well as the PRU, but the PRU decided to keep him on. So the Link School kept him, despite that ongoing knock-on effect for other children that need that provision. So they're going in there for a 12-week behavioural sort of stay. So they're there for 12 weeks, they come back out with the tools that they need to get them through in mainstream. My child was never going to make it in mainstream. So that then took up a space for a child that could have, because he was there for 2 years before he got placement, and then I had to go to appeal for that. I had to go for appeal to get him in an EHCP. Everything was it's just appeal after appeal after appeal, and the local authority system is no you can't, no you can't, no you can't. So you go okay, as a parent you go okay, and then you think hold on, I'll look at what the law says, and it's like yes I can. Yeah. But their policies, the local authority policies don't necessarily band with what the law says with education. Yeah. And because they don't want as many parents coming into the system and fighting for their children. I know that sounds really awful, but I've got caseworkers that are meant to be there for my child who have never met him, who are telling me that he's fine in mainstream and that he's not allowed to go to that school because that's an independent school. And after a whole year of fighting to get him into the school that I wanted him in, it was overturned in a mediation session a week before the appeal. And the judge had just said, I don't know what you're doing. Here you go, there's the school. I've told the local authority to overturn it. And that all happened within 15 minutes. But that 15 minutes was fine. It happened in 15 minutes. But why didn't that happen a year ago? Yeah. Why did I have to fight for a whole year while he was in a school that was providing education, but supporting him meant other children couldn't come into that educational environment to get the support that they needed to go back into mainstream. And the system just, it chews the kids up and it spits them out. And at the end of the day, I mean, I'm lucky. Max got into his school in December, and he's absolutely flying. And he goes into secondary next year, and he's in the same school. He gets to stay in the same school. The reason why I fought for that school was because it'll take him up until he's 19. And he's doing amazing. I mean, he's still behind his peers because he's lost out on education since year 2, but he's 11 and he's loving it. And it's the first time he's ever loved school. So because he's loving school and we're not having the problems at school anymore, I'm getting them all at home. I love him though, very much.
Thank you, Hurley.
Sorry.
It's okay, it's fine.
Sorry.
No, don't be. I'm aware that there were a couple of other questions, but if you do have questions for our speakers, please do come and approach them during the lunch break. Just before I hand back to Ashley, if we could perhaps just thank again all of our speakers for your presentation.
Can I just say one thing? It goes on tour next year, the blanket, if anyone wants to host it. And I'd just say the blanket will go on tour around England. We hand it to the Children's Commissioner in December, and it will be in London for 3 months, 3 to 4 months. And we need money. Yeah. But if you would like to host the blanket to reduce exclusions locally, if you think it'd make a difference, or have an event, just please email me. Okay, sorry, Dougal.
Wow. I'd just like to particularly thank all of the speakers this morning. I think, Hayley, thank you. I think one of the things which really struck me there was the thread through that about the funding in schools, schools in crisis, and that actually there are children that are in the middle of all of that. And not every child, the story you told, really powerful, but there are children who don't have people to advocate for them in the way that you did. And we all need to be there to advocate for all children. So thank you for that really powerful story and thinking about, the thread from the beginning to the end of today's presentations. I hope you've enjoyed your morning. I think we've had some fantastic presentations, starting with our transdisciplinary placements, which I hope you were inspired about with all of those, and then all of the sessions we've had this morning. Much more to come this afternoon. So thank you all for your attention. I hope you enjoy your lunch. Do take opportunity to talk to some of the speakers where if you had questions and didn't have time to ask those questions. Kyra, I love your bubble machine, and I'm sorry we didn't see it more. So actually, I would like the speakers to have spoken over their time so we could have more bubbles. So that we might just adopt that one. Thank you all very much. Can I remind you that lunch will be upstairs where the posters are, and if you'd like to go for a walk at lunchtime, we're gathering at the entrance to go for the walk, not around the Botanic Gardens, but around some lovely gardens, if you'd like to go and do that at some point. And we're back here this afternoon for 1:45 for a keynote from Leah Silva and Liz Green from the Welsh Health Impact Assessment Unit. And Public Health Wales are doing some fantastic work, so look forward to hearing from them. Okay, thank you all.